Jeffrey B. Healing Shame, July 13th, but it's Saturday, so we can't have the Fear of Friday the 13th going on. Trigochidecaphobia, whatever that is. Trigodochidecaphobia. Some long ass name. I couldn't remember it. That's okay. Anyway, this is Healing Shame with your boy Jeffrey B. It is July 13th. And what I want to discuss today basically is I'm at the end of tray one with Invisalign. Okay. I was supposed to change out to tray two today, but it's getting pushed back a day because I'm not able to see my dentist until tomorrow. And during that time, he'll shave down the politics to very thin so that there's no problem seating this lower tray properly. And he's going to shave down the pontic on a few trays, I think trays 2 through 5, just to be safe. So that's what we're going to do tomorrow. But I just want to talk about a couple things I've learned. The first thing is before you start any orthodontic journey, Invisalign journey, get second opinions, get third opinions, fourth opinions, however many you need, and however many options are presented to you so you can weigh it all and see which one is least invasive and you're most comfortable with and most affordable. There are a lot of things to consider. Some of the mistakes I feel I've made along the way was just jumping in. I did get a couple of different ideas, but I only really did one consultation with a dentist, a full, real free consultation, where they got the tooth scan and all that. And that process right there was enough for me to not want to do any more. It was very intense, having to do all the scan of your teeth and all that. It was a lot of work, really, just to go through that process even. So, you want to get as much information as you can from as many trusted sources as possible, because I've talked to a couple of different doctors, and they're like, well, maybe he shouldn't have pulled this tooth. That seems a little excessive, and blah, blah, blah. Although there are cases where that lateral incisor is pulled, the same exact one, and things are fine. The gap closes and everything is okay. But I've got recession, so that's something to look at as well. Look to see if you have recession. If you've got it, blah, blah, blah. Maybe you want to wait, do some gum grafting first, and then come back a year later or something, or half a year later, and then start Invisalign. That's a pretty big thing to look at. The trays themselves, okay. If you're uncomfortable with something on your teeth, don't do this right now. Or try to do one tray at a time, because it can provoke a little bit of anxiety and restlessness and feeling like you want to just take them off, like you can't stand it and you've got to take these things out. You want to get them off your teeth because your teeth need to breathe, believe it or not. The teeth need to breathe. And if you got this stuff just suffocating your teeth, you feel like you can't breathe. And yesterday I did the Muay Thai training, and the first thing I wanted to do was drink water, rest on the ground, and rip these aligners off of my teeth so I feel like I could really take a deep breath, because they do cause a little weird sensation back here, like you're got something in your throat, or you just have to have them on to know. But anybody who's got this journey going, you know what I'm talking about at first. So it's something to consider if you have any kind of anxiety, or you don't feel like you can deal with this kind of shit, which I understand completely now, especially now. I can only imagine trying to do something like this at 17 or have braces on at that age. I probably would have just cut them off myself because I couldn't have stood it. This journey takes a ton of discipline, dedication, patience, willpower, determination. It's a tough journey, I'm not going to lie. and I'm only at the end of my first tray. At least I made it through the first tray. I didn't know if I was going to be able to do that. I thought I made a huge mistake. I was like, I'm done. Fuck, let's put that tooth back in. I'm done. I'm putting an implant in. Woohoo! It's scary, man. But if you can just suck it up and try your best, you can get through it. But it does take a certain type of mind. Okay, I'm just going to tell you that now. Other things I've noticed or learned is that I don't have a pull tool. Some of you got ortho keys, and it just lets you lift up the back end of the aligner so you can pull them off gradually, right? I don't have an ortho key, and my dentist wants me to use my finger. Now, the finger works fine on the top, but trying to come like this, no, 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 no. On the bottom, it doesn't work. I'm cutting into my gum and it's bleeding back there, and I can't get a hold, and my fingernails bending back and all that. That's why I had to cut them so short. So what I do is I take a paper towel, right, or a tissue or something. I take a paper towel here like this, and you just get a better grip on it, and you lift up like that. You put it back in there, huh? And then the other side, it just lets you get a grip on the edge of the back end of that aligner, so you can grab it, get a grip on it and lift up. Otherwise, the finger's slipping off, the nails bending back. This has been a lifesaver, and I had to look that up online. Whew, it's a process, fellas, ladies and gentlemen. It's tough. I've learned that. Use some shampoo or soap to clean out your liners because they do smell like a petri dish. Basically, you're just letting bacteria build up in there, and inside and outside, there's like a film, and it's like a petri dish, basically. Bacteria growing, the little agar culture, right? You got the agar plate and the petri dish, and the bacteria grows in there, covered in the moist human condition. Boy, it's a breeding ground for bacteria in here, right here. So you got to use soap, use your toothbrush, brush in there, brush it off, use some toothpaste and all that. They told me you don't need anything except just brush it out. No toothpaste, nothing. That's not true. If you just use the toothbrush, these bad boys are going to be smelling like a petri dish. So you got to try something. I'm probably going to, when I get back to the States, I'm probably going to try to find some kind of soak or something where I can try to soak once a week, soak my trays in some kind of cleaning solution. Time yourself when you're eating. What I do is I put a timer on. As soon as I take the liners out, I come out and set my timer. So I usually set it for 45 minutes, and I'm usually done. I usually got 10 minutes to spare. So I've been wearing them 22 hours a day. So my teeth should be tracking right. So tray number 2 should go on well once the pontic gets shaved down and should fit snugly, and there shouldn't be any halos, halos as they call them, gaps between the top of the teeth and the aligner, the inside of the aligner. I also feel like these things may also help cause or induce more sinusitis, I think, because of bacteria and all that building up on back in there, and you can get it, swallow it, and get in your throat and cause throat infections, upper respiratory infections more easily with these things on. I don't know, just something I've noticed. I'm having a lot of throat trouble and stuff. It could be the AC. Got the AC right here blowing on me all the time. Could be bad, dirty filters. But that's really all today. I just wanted to talk about what the end of this journey, the first tray, has been like. Tomorrow, I'm switching out, like I said, to tray 2. It's been tough. It's been a tough 2 weeks, and I know the next trays are going to be very tight and hard to get off and all that, and it's going to be moving these teeth towards that gap, and that makes me nervous because it's going to be harder to get the trays off, and the teeth are going to be getting looser, but they'll also be getting closer to the final position. So one step at a time, take it easy. I got into an Invisalign support group on Facebook. Good to put your stuff out there. Just vent, rant, whatever, and try to identify and look for support in those groups as well. So that's all I've got, ladies and gentlemen. I'm going to end it there. And good luck on your journey. Or if you're just curious, then enjoy my journey. Okay, living vicariously, right? Okay, until next time, all the best.